Hello, everyone. My name is Dr. Bishoy Awad, and I am a gynecologist, and my specialty is infertility in women who are affected by diseases that tend to cause infertility. I work in a very small town in Fort Worth, Texas, where there's a lot of cases in teen pregnancies and infections that are caused by lack of hygiene and lack of education for taking protective measures during sexual intercourse. In my office, I usually run into all kinds of cases from STDs to HIV to everything that has to do with sexually transmitted diseases. But the one that I think is most underrated is the pelvic inflammatory disease. And I usually run into, like, let's say out of 15 patients, I have 9 patients that have had some encounter with a pelvic inflammatory disease. And basically, it's an infection in the female reproductive organs. So from anywhere from the ovaries to the vagina to the tract and all of that good stuff. It usually occurs when sexually transmitted bacteria spread from your vagina to your uterus, fallopian tubes, or ovaries. Pelvic inflammatory disease is often has no signs or symptoms. As a result, you might not realize you even have it, and the condition, like, it needs treatment right away. Um, and it might be detected later if you have trouble getting pregnant or if you develop chronic pelvic pain. And the symptoms may include pain in your lower abdomen and heavy vaginal discharge or abdominal uterine bleeding, especially during or after intercourse, and between menstrual cycles, pain or bleeding during intercourse. Now that sounds pretty bad, right? Now, for the treatment, I will usually prescribe some kind of antibiotics, and for the patient to be fully capable of full recovery, they have to finish the whole antibiotic. Like, they cannot just stop as soon as they see improvement. They have to finish the whole thing, or their body's going to build immunity, and it's going to become worse, and it's going to become more immune. And also for preventative measures, I usually like to have the partners get tested, and every person to kind of have an open conversation with their partner about how many sexual partners they've had, about what their previous sexual history is, if they have any previous diseases, and basically covering their bases so we prevent the least amount of infection. Uh, Now, even the sexual partners should be examined, and although they may not have noticeable symptoms, this treatment is like this checkup is very crucial. Um, so now I will tell you about a case study that I've had, and it's a female of 19 years old. She has an ethnic past of Hispanic and Latino. She comes from a lower middle class, and she has surprisingly had no previous infections, although she practices sexual intercourse without any condoms, without any kind of protection, and she doesn't get checkups, which is super dangerous. And the main thing is, she started experiencing these things, and the perfect thing that got her to on her way to a speedy recovery is the fact that she came in for a checkup. Now, thankfully, her case was not that bad, and she was cured by antibiotics. Now, for the preventative measures, I have very few simple steps to help fight this epidemic. Every health professional should have an open conversation with every patient that they get. Doesn't matter if they haven't been sexually uh, exposed to any of this, or it doesn't matter if they have a history of sexual organ infection or not. I would recommend that every health professional to have an open conversation and educate them, because people these days don't go out and look up stuff about infections and STDs and STIs because there's so much stigma around this. And if you look it up, it's basically you're treated like you have it. Now, the second thing is to get tested and to inform that the risk of an STI such as chlamydia, make an appointment for testing. Is making an appointment for testing is very important, because these things could lead to infertility, and that could literally ruin lives. Um, and regular screening and all this stuff is super crucial whenever you are having multiple sexual partners. Now, the third and most important, request your partners to be tested, and that is my most stressed part of my prevention process is because you may take all the preventative measures you want, but if your partner does not, they will infect you, and all that you've done, all the preventative measures you've taken is for nothing. Now, the third is the fourth, my bad, is to practice safe sex and inform them of the importance of using a condom every single time they have sex with someone that they are not in a monogamous relationship with, and ask about potential partners, ask about how many partners the other partner has had, everything, so they cover their bases and they know what they're getting themselves into. What's important for me to convey to you today is that people today are not educated about disease, but instead that they are just full of stigma, they're full of fear, they're full of irrational thoughts about getting tested and going out and getting educated about this stuff. And I think that by educating them on very simple steps could quite literally save their lives and save their family and prevent possible infertility. I know that education sometimes is not even good enough to reach out to the youth because stigma and social pressure will choke out any efforts that we as health professionals take. But I think it is our duty to take these preventative measures and to apply them into our communities to prevent epidemics like this from happening. Thank you so much.